As we've been reporting, the more contagious Delta variant is now the dominant coronavirus strain in the U.S. According to the CDC, at least 25% of new cases in the U.S. are linked to the variant, and the agency says it accounts for nearly half the number of cases under a sequencing program that monitors emerging strains of the virus in some communities. This comes as low vaccination rates and eased restrictions across the country renew concerns from health experts about how to keep Americans better protected from contracting COVID. Dr. Leo Nissola is an immunotherapy scientist and an advisor to COVID Act Now. He joins us now with some medical insight. So, Doctor, the Delta variant is, of course, now the most dominant strain in the U.S. What are you looking for? What are you watching for as it continues to spread across the nation? It's clear, I think somebody posited this the other day, that we're in the sort of the phase of the pandemic where if you're getting infected and you're finding yourself in the hospital and that you're sick, there's a choice. You can be vaccinated and not find yourself in the hospital, even if this variant is out there rampaging across the country.
That's right. Well, look, last month, 9 out of 10 people who were sick with COVID were unvaccinated. We now have safe and effective vaccines that have been proven to not only work against mild and moderate disease, but also severe disease and prevent death. I think we are experiencing a very interesting period in our society generally at this point, where we have over 7,000 people dying every day last week all over the world. The world scrambling to continue to persist with their societies and their people dying without any healthcare supply that would make the vaccines more available to their people there. And here we have unvaccinated Americans completely refusing to wear a mask when they go outside, completely refusing to be vaccinated while we still have a Delta variant there. Now, for me, it's especially concerning because we are also having a little bit of a challenge on communicating the Delta variant with the American population in a way that it makes sense for people to get on under the same tent. You see, I think much of the anxiety that the headlines around the Delta variant have been causing are driving people away, whereas we should be bringing them on board. Now, it's important for us to communicate how safe these vaccines are, how effective they are into preventing moderate and severe disease, and making sure that folks understand that the way out of this pandemic is through vaccination. Sure, that the immunization may occur naturally upon infection with the virus, but then again, the body needs to do the buildup of that immunity, and not everyone has the same capability of producing antibodies. So it's complicated.
So just to complicate things a little more, and I will sort of preface this question by saying, listen, the overall consensus is that it's better to be vaccinated than not. But now we have a case of a Texas man is vaccinated with the Johnson & Johnson shot. He is now in intensive care after doctors confirmed that he caught the Delta variant. Now he's in his early 60s. He's 64, I think. But he was inoculated in March and got sick in June, so he should be fully vaccinated. How concerning is this for you, and how concerning should it be for others? So
let's make one thing clear. Breakthrough cases exist. Breakthrough cases exist in every vaccine that we have available for any condition. They are known to exist through the course of history of our vaccination efforts. Vaccines have saved hundreds of thousands of lives every day. In fact, there is a recent study that just showed that over 300,000 people in the United States have been saved by the U.S. successful vaccine rollout. Now, that said, we are not also promising that the vaccine will be an end-all, be-all for everyone in a standard fashion. Again, the body needs to develop immunity. People in the United States have medical conditions like anywhere else in the world that also impact their ability to produce antibodies and to build lasting immunity. Now, when we talk about vaccine efficacy, it's important to remember that we are basing our claims on clinical trials that were run by companies that produce these drugs. drugs. Now, the trials show us what the data can show us is that how safe these vaccines are. Now, when we talk about J&J's vaccine single shot, the effectiveness of that vaccine may be close to 85%. 85 is not 100%. No one said it was going to be 100%. So in that sense, it's also important to understand how much effort has taken us to get us to a place where we have now safe and effective vaccines that prevent disease in a great percentage of the population. Unfortunately, breakthrough cases do exist. Unfortunately, they are associated usually with other medical conditions. That particular case you're talking about, I have not looked into the clinical raw data to understand what potential clinical features that patient had that would perhaps respond to that question. But I'm sure the federal agencies are looking into these data and the companies as well to better understand where do we go from here. Now, as you mentioned, and I think the message is go get vaccinated, whether or not you received the first shot from Moderna's or Pfizer's vaccine and you need a second shot, or if you have not received any vaccine at all. There's also data showing that folks are skipping the second dose, which worries me, especially because of the Delta variant.
So, Doctor, let me ask you about some ride-sharing companies like Via, which have resumed shared rides in New York City. Via says it plans to have windows down during a majority of rides and recommends passengers wear masks for the people who make the decision to share a ride with a stranger. What are the risk factors associated with this if, let's say, you're not vaccinated?
I mean, ride sharing, it's very complicated because you're limiting yourself to a very small space with someone that you don't know anything about, including what they're carrying with them, whether they are vaccinated or not, whether they have the deadly virus that is out there today still, or a new variant. So I'll be extremely concerned on entering one of those rideshare cars. However, opening the windows and making sure that the ventilation is occurring in a natural way without air conditioning is important. Very challenging to do when New York is so warm, understandably.
All right, Dr. Leo Nissola, thank you as always. We appreciate it.
Thanks for having me.